Hello, let's talk about axillary artery and brachial artery. So first we will talk about the axillary artery. So the axillary artery is located in the axilla. Okay, and it originates from as a continuation of the subclavian artery at the outer border of the first rib. Okay, so this is the outer border of the first rib, and here the axillary artery originates as a continuation of the subclavian artery, and then at the lower border of the teres major muscle it terminates, and then it continues as the brachial artery. Okay, brachial artery is located in the arm, while the axillary artery is located in the axilla. So it's about the origin and the termination of the axillary artery. Now the axillary artery is divided into three parts. The first part, okay, first part is this one, then the second part, and then the third part. These parts, axillary artery is divided into three parts by pectoralis minor muscle, and here the muscle has been cut down. So the part which is above the pectoralis minor is the first part, okay, then the part which is behind is the second part, okay, and then the third part which is below the pectoralis minor muscle is the third part. So the axillary artery is divided into three parts. Then the branches of the axillary artery gives six branches, okay. One branch from the first part, two branches from the second part, and three branches from the third part. So remember the rule of 1 2 3. First part give one branch, second part gives two branches, and third part gives three branches. So the branch which comes from the first part of the axillary artery is this one, okay. This is the superior thoracic artery, okay, which supplies the intercostal muscle. So the first part gives superior thoracic artery, then the second part gives two branches, one at the upper border of the pectoralis minor muscle, which is thoracoacromial artery. This is thoracoacromial artery, okay, and the second branch is from the lower border of the pectoralis minor muscle, which is lateral thoracic artery. So the second part gives thoracoacromial artery and lateral thoracic artery. This is lateral thoracic artery, okay. So these are the two branches from the second part. Then the thoracoacromial artery again give four branches. You can remember it by A, P, C, D. Okay, the branches of acromial artery you can remember by A, P, C, D. A for acromial artery, okay, acromial branch. Then P for pectoral branch. This is pectoral branch, okay, and this one which is goes upward towards the acromion process is the acromial branch. Then C for clavicular branch. This one is clavicular branch, okay. This one is clavicular branch, and the third branch is deltoid branch, okay. So the four branches of the thoracoacromial artery is A, P, C, D: acromial, pectoral, clavicular, and deltoid branch, okay. So this is about the thoracoacromial artery. Then from the third part there are three branches. The first branch is this one, okay. This is first branch from the third part of the axillary artery. It is the subscapular artery, okay. So this one is subscapular artery. Subscapular artery give the circumflex scapular artery, okay. So this one is circumflex scapular artery. Then the second and third branch is interior circumflex humeral artery, okay. This is interior circumflex humeral artery, and the other is posterior circumflex humeral artery. Okay, so the three branches from the third part of the axillary artery is, the first one is subscapular artery, then it gives the circumflex scapular artery, and the other two branches are anterior circumflex humeral artery and the posterior circumflex humeral artery. And these two arteries, interior and posterior circumflex, anastomose around the surgical neck of the humerus. Okay, so this is the interior, and this one, the on the posterior side, is the posterior circumflex humeral artery. So this is about the branches of the axillary artery. So let's summarize what we have been through. So the axillary artery originates as the continuation of the subclavian artery at the outer border of the first rib. Okay, then it terminates on the lower border of the teres major muscle. Okay, and it is divided into three parts. Okay, the first part is above the pectoralis minor muscle, the second part is below the pectoralis minor muscle, and the third part is below the pectoralis minor muscle. Okay, so the first part above, second part behind the pectoralis minor, and the third part is below the pectoralis minor muscle. And then the branches, six branches, uh, one from the first part of the axillary artery, which is superior thoracic artery, then the two branches from the second part, first is thoracoacromial artery, and then the second one is lateral thoracic artery. Okay, and then the three branches from the third part, first is subscapular artery, and the second and third is interior and posterior circumflex humeral artery. So these are the branches of the axillary artery. Okay, now we will discuss the brachial artery. So before discussing the brachial artery, let's talk about the anastomosis around the scapula. Okay, so anastomosis around the scapula, it basically connects the subclavian artery, the first part of the subclavian artery, to the third part of the axillary artery. So this is the importance of the anastomosis around scapula. So the anastomosis, the arteries which contribute to the anastomosis around the subscapular artery is three in number. Okay, the first artery is suprascapular artery. It comes from the thyrocervical trunk, which is the branch from the first part of the subclavian artery. Okay, then the dorsal scapular artery, it is also it is the deep branch of the transverse cervical artery, which also comes from the thyrocervical trunk. So thyrocervical trunks give two branches to for to anastomose around the scapula. So the first is suprascapular artery, this one. Okay, suprascapular artery, the branch of thyrocervical trunk, and the dorsal scapular artery. Okay, this one. So these arteries comes from the first part of the subclavian artery. Then the branch from the third part of the axillary artery is the circumflex scapular artery, which arises from the subscapular artery, which is the branch of the third part of the axillary artery. So the three arteries contribute in the anastomosis around the scapula: the suprascapular artery and the dorsal scapular artery. These both come from the thyrocervical trunk, which comes from the first part of the subclavian artery, and the third artery is circumflex scapular artery, which arises from the subscapular artery, which is the branch of the third part of the axillary artery. Okay, so basically the anastomosis around scapula connects the first part of the subclavian artery to the third part of the now let's talk about the brachial artery. So as we mentioned before, that the brachial artery is the um, continuation of the axillary artery at the lower border of the teres major muscle. So at the lower border of the teres major muscle, the axillary artery continue as the brachial artery, and brachial artery is located in the arm region, and then it terminates opposite the in the cubital fossa opposite the neck of the radius. Okay, so this is the termination point. It terminates into ulnar artery, which is medial in the forearm region, and the radial artery, which is lateral forearm artery. Okay, so this is about the origin and termination of the axillary artery. It originates at the lower border of the teres major muscle as a continuation of the axillary artery, and then it terminates opposite the neck of the radius in the cubital fossa to give the radial and ulnar artery. Then the brachial artery in its course, it is related to two structures. Okay, so the brachial artery is related to two structure. One is muscle, which is the bicep muscle. Okay, so it is related to the biceps muscle. You can see this is the bicep muscle. Okay, and at the medial border of the bicep muscle, the brachial artery runs downward in the arm. Okay, so this is the first structure which is related to the brachial artery. Then the other structure is median nerve. Okay, so this is median nerve. Okay, so it is related to the brachial artery in three ways. Okay, it is related to the brachial artery in three ways. So in the upper arm region, the median nerve is lateral to the brachial artery. Okay, so in the upper arm, the median nerve is lateral to the brachial artery. Then in the middle of the arm, in the middle, you can see the median nerves passes interior to the brachial artery. So you can see that the median nerves pass interior to the brachial artery. So this is in the mid arm, while in the lower arm and the cubital fossa, in the lower arm and the cubital fossa, the brachial artery becomes lateral. Okay, while the median arm become medial to the brachial artery. So this is median nerve. Okay, this is median nerve, and this is ulnar brachial artery. Brachial artery is lateral, while the median nerve is medial to the brachial artery. So this is relation of the median nerve to the brachial artery. Then we will talk about the its branches also. Okay, so how many branches and which branches brachial artery give? Okay, so the main artery which comes from the brachial artery is the profunda brachii artery. Okay, so this is profunda brachii artery, this one. So the profunda brachii artery is the main branch of the brachial artery, and the profunda brachii artery, when originate from the brachial artery, it turns around the posterior humerus, and then it comes into the interior arm as and continue as the radial collateral artery. Okay, so the profunda brachii artery goes to the posterior arm on the behind the humerus, and then it comes to the interior arm, interior lateral arm, and continue as radial collateral. Okay, so the brachial artery in the posterior form of arm or in the posterior compartment, it also give medial collateral branch. Okay, medial collateral artery. Then the other branches from the brachial artery, the superior ulnar collateral. Okay, so this is superior ulnar collateral and inferior ulnar collateral. Okay, so the brachial artery gives profunda brachii or deep brachial artery. Okay, Then the profunda brachiae artery continue as medial collateral artery. It also gives superior ulnar collateral and inferior ulnar collateral. And at the opposite the neck of the radius, okay, opposite to the neck of the radius, the brachial artery divide into the ulnar artery and the radial artery. Okay, so this is about the brachial artery. So let's summarize what we have been through. So brachial artery originates at the lower margin or lower border of the teres major muscle, um, as a continuation of the axillary artery. Okay, so this is brachial artery and it terminates opposite the neck of the radius in the cubital fossa into two terminal branches, ulnar artery and radial artery. Then the brachial artery gives its main branch, which is called profunda brachiae or deep brachial artery. Then the brachial artery runs behind the humerus, and then it continues on the lateral side as radial collateral artery. Okay, then it also gives the superior ulnar collateral and inferior ulnar collateral. So these are the branches of the brachial artery. Then you can see this is the axillary artery. Okay, axillary artery, the lateral thoracic, the subscapular artery, which is a branch from the third part of the axillary artery. Then the interior and posterior circumflex humeral artery also comes from the third part. Then this is the lateral thoracic artery from the second part of the axillary artery. Thoracoacromial artery also comes from the second part of the axillary artery, and thoracoacromial artery give A, P, C, D: acromial branch, pectoral branch, clavicular branch, and deltoid branch. Then the superior thoracic artery is the branch from the first part of the axillary artery. So this is about the axillary and brachial artery. Thank you.